Welcome to our deep dive today.
Mm-hmm.
We're going to be tackling something
Yeah.
pretty important, I think, for anyone going through cancer treatment.
Yeah.
Um, neutropenic fever.
Right.
And you sent over some research on it,
Mm-hmm.
and it definitely raises some serious questions.
For sure.
So let's break it all down
Absolutely.
for you. So to start off,
Yeah.
neutropenic fever basically means you
Yeah.
develop a fever when your white blood cell count,
Right.
specifically the neutrophils
Yeah.
that fight infection, are super low.
Exactly.
And chemotherapy, which is often a cornerstone of cancer treatment,
Mm-hmm.
can unfortunately cause this.
That's right. And it's important to remember that neutropenic fever isn't just like
Right.
a minor inconvenience or anything. It's a serious medical situation
Yeah,
that needs immediate attention.
for sure.
The research you provided paints a pretty stark picture, actually.
Yeah, the numbers were a bit eye-opening.
Yeah.
It affects way more people than I initially thought.
It's not just a small percentage, unfortunately.
Right.
Studies suggest that up to 50% of patients with solid tumors
Wow.
and over 80% battling blood cancers or receiving stem cell transplants
Okay.
can experience neutropenic fever.
Wow.
And what makes it even more concerning is the potential severity.
You're referring to the mortality rate, right?
Exactly.
The research mentioned some pretty alarming statistics.
The in-hospital mortality rate for neutropenic fever kind of hovers around 10% overall,
Yeah.
and it sadly jumps even higher for leukemia patients exceeding 15%.
Oh, wow.
So that really underscores why it's so critical to understand this condition thoroughly.
It's definitely not something to take lightly.
No.
So it's more than
Yeah.
just feeling a bit under the weather after chemo.
Yeah,
It's a potential emergency.
for sure.
And the research delves into why this happens, which I found really fascinating.
Mm-hmm.
It's not just about low white blood cells, right?
You hit the nail on the head. Chemotherapy doesn't just wipe out neutrophils. It throws your whole immune system off balance.
Got it.
Lymphocytes and platelets, other vital components of your immune defense, also take a hit.
Interesting.
Even the lining of your gut, which plays a surprising role in immunity, can be affected.
So it's like a domino effect.
Right.
Weakening one part of the system leaves you vulnerable on multiple fronts.
Precisely. The research actually uses the phrase perfect storm
Oh, wow.
to describe this situation,
Okay.
where your body's ability to fight infection is significantly compromised.
Right.
And that leads us to the next point,
Okay.
which is understanding what can trigger these infections in the first place.
Right, because if the body's defenses are down, even the smallest threat could become a problem.
That's absolutely correct. And the culprits can come from seemingly harmless places.
Really?
For instance, the bacteria that naturally live in our gut can sometimes leak into the bloodstream
Oh, wow.
when the gut lining is compromised,
Okay.
leading to a serious infection. Of course, there are more obvious sources like infected catheters or even just breathing in bacteria or fungi from the environment,
Right.
especially in hospital settings.
Makes sense. It's a bit unsettling to think about how many potential risks there are.
It definitely highlights why prevention and early detection are so crucial.
Yeah.
And that brings us to another really interesting point from the research,
Okay.
recognizing the signs of neutropenic fever.
Right.
We tend to think of fever as the telltale sign of an infection,
Yeah.
but it's not always so straightforward.
Yeah, the research mentioned that not everyone experiencing neutropenic fever actually feels feverish,
Right.
which is a bit counterintuitive, right?
Right. The symptoms can be surprisingly vague.
Oh.
You might feel incredibly tired, have a nagging cough, or experience nausea.
Sure.
Some individuals even exhibit confusion or unusual behavior changes.
Wow. So it's not always a blazing fever that sends you running to the doctor.
Exactly, and that's where the danger lies.
Right.
People often brush these subtle signs off as just a bug or a side effect of treatment,
Yeah.
leading to delays in seeking medical attention.
I can imagine that happens a lot.
Yeah.
Especially when you're already going through so much with cancer treatment.
Uh-huh.
It's easy to want to downplay any additional discomfort.
The research actually found that the average delay in seeking help for neutropenic fever is over 11 hours.
Wow.
In a situation where every hour counts, that delay can have a significant impact on the outcome.
That's a pretty sobering thought.
No.
So it's really about being vigilant and not dismissing any unusual symptoms,
Mhm.
no matter how minor they might seem.
Right.
Knowing what to look out for could be life-saving.
Absolutely. Early recognition is key.
Got it.
And once medical attention is sought, the next crucial step is getting a prompt and accurate diagnosis.
Okay.
That involves a bit of detective work, so to speak.
Tell me more about that. What does the diagnostic process look like?
It typically starts with blood cultures, which are essential for trying to pinpoint the specific bacteria, virus, or fungus causing the infection.
Right.
But the path doesn't end there.
Got it.
Depending on your individual symptoms, doctors might order other tests like CT scans to check for internal infections,
Uh-huh.
urine tests to rule out urinary tract infections,
Okay.
and a whole array of other assessments tailored to your specific situation.
So it's not a one-size-fits-all approach.
Exactly.
It's about piecing together the clues to figure out what's really going on.
Precisely. Doctors use a variety of tools to assess the situation,
Yeah.
including a scoring system called the MASCC score.
Interesting.
This score takes into account various factors to determine the level of risk
Right.
and helps guide decisions about whether someone can safely be treated at home
Yeah.
or needs to be hospitalized for closer monitoring.
That makes a lot of sense. A standardized way to evaluate the severity and tailor the response accordingly.
Exactly. And it's important to remember that several factors contribute to a patient's risk level beyond just having low neutrophils.
Right.
For example, having a neutrophil count below 100 cells per cubic millimeter,
Oh, wow.
or experiencing neutropenia for an extended period, like
Right.
longer than 7 days,
Yeah.
significantly increases the chances of complications.
So it's not just about the presence of low neutrophils.
Right.
It's about the severity and duration of that low count.
Exactly.
It's a much more nuanced picture than I initially realized.
You're absolutely right. And this understanding of risk factors and diagnostic tools
Yeah.
sets the stage for the next critical part of our discussion.
Okay.
The various treatment approaches for neutropenic fever.
That's where things start to get really interesting, right?
Yeah.
We've laid the groundwork,
Uh-huh.
understanding what causes this condition and how it's diagnosed.
Yeah.
Now let's delve into those treatment options in part 2.
Perfect. So when it comes to tackling neutropenic fever, doctors often take what the research calls a two-pronged approach, focusing on both pharmacological and non-pharmacological interventions.
Right.
And it's fascinating how these two sides intertwine
Yeah.
to support patients during this vulnerable time.
I'm really curious to unpack that.
Yeah.
Let's start with the pharmacological side.
Sure.
What does that involve?
Pharmacological interventions really boil down to using medications strategically to combat infection.
Okay.
And it starts with prevention.
Got it.
For patients deemed high risk,
Okay.
think those with severely compromised immune systems or specific types of cancers,
Yeah.
doctors often prescribe prophylactic medications.
Okay.
That means they'll receive antibiotics, antifungals, or even antivirals before their neutrophil count drops too low,
Okay.
aiming to prevent infection from taking hold in the first place.
That makes sense, creating a sort of protective shield in advance.
Right.
But what happens if, despite these preventative measures, someone still develops a fever?
That's when things get really urgent.
Okay.
The research really stresses the importance of the golden hour.
Right.
That first 60 minutes after a fever is detected. Ideally, broad-spectrum antibiotics should be administered within that time frame,
Wow.
even before the blood culture results are back.
60 minutes. That highlights the seriousness of this condition.
It is.
But it's not just about speed, is it?
Right.
Choosing the right antibiotic seems crucial as well.
Absolutely. And that's where the expertise of infectious disease specialists comes in, with antibiotic resistance becoming more prevalent.
Right.
Doctors have to carefully consider a patient's medical history,
Yeah.
any recent antibiotic use, local patterns of bacterial resistance,
Okay.
and potential interactions with other medications they might be taking.
So it's a delicate balancing act.
It is.
You want to hit the infection hard and fast.
Right.
But also make sure you're using the most effective weapon
Yes.
without inadvertently contributing to the problem of antibiotic resistance.
Precisely. And it's worth noting that even with the best chosen antibiotic, fever can sometimes persist for days.
Really?
This can be understandably concerning for patients and their families,
Right.
but it doesn't always mean the treatment is failing. It might just be the body's natural course of fighting the infection,
Yeah.
especially when the immune system is weakened.
I imagine that requires a lot of patience and clear communication
Definitely.
from the medical team to reassure everyone involved.
Transparency and open dialogue are essential.
Right. Yeah.
Now, there are other pharmacological interventions that might come to mind,
Okay.
like growth factors or granulocyte transfusions, which aim to boost the body's white blood cell count directly.
Okay.
However, the research you shared
Yeah.
indicates that the evidence supporting their routine use in neutropenic fever is still somewhat limited.
Got it.
There's ongoing debate in the medical community about their effectiveness in this specific context.
So they're not entirely off the table,
Right.
But more research is needed
Exactly.
to determine when and how they might be most beneficial.
Huh.
It's a reminder that medical science is constantly evolving.
Absolutely. Now let's shift gears and explore the other side of the coin.
Okay.
The non-pharmacological interventions.
Okay.
These encompass a range of supportive care measures that go beyond medications.
So what kinds of things fall under this umbrella?
For severe cases of neutropenic fever, especially those with complications or significant drops in blood pressure,
Okay.
the intensive care unit, or ICU,
Yeah.
often becomes the best place for providing specialized care and close monitoring.
The ICU sounds pretty intense. What happens there?
Well, it's all about providing the body with the support it needs
Okay.
to weather the storm.
Right.
This might involve IV fluids to maintain hydration and blood pressure,
Mm-hmm.
medications to stabilize vital signs,
Yeah.
and even mechanical ventilation if the lungs are affected,
Okay.
which can sometimes happen with severe infections.
It sounds like a multifaceted approach,
It is.
addressing both the immediate threat of the infection
Right.
and the body's overall ability to cope with the stress.
That's a great way to put it.
Okay.
It's about providing holistic support. And another crucial non-pharmacological intervention,
Okay.
particularly if a catheter is suspected as the source of infection,
Right.
is its prompt removal.
Okay.
This can be a simple but incredibly effective step
Yeah.
in controlling the infection and preventing it from spreading.
That really highlights the importance of meticulous hygiene and infection control measures
Definitely.
in healthcare settings,
Yes,
especially for patients who are already vulnerable.
absolutely. Every little detail matters.
Right.
But treatment isn't just about the here and now.
Okay.
It's also about looking ahead to the long-term implications
Mm-hmm.
and emerging trends
Mm.
that are shaping how we approach neutropenic fever.
That's a great point. This isn't a one-and-done situation.
Right.
What are some of the exciting developments on the horizon? It's encouraging to hear that there are positive trends emerging.
Yeah.
The research you sent mentioned something called antibiotic stewardship, which caught my eye. What exactly does that entail?
Antibiotic stewardship is essentially a philosophy.
Okay.
You could say that guides how we use antibiotics responsibly,
Okay.
both in hospitals and in the wider community.
Right.
It's about making sure we're using these powerful drugs
Yeah.
only when they're truly necessary,
Right.
choosing the most appropriate antibiotic for each specific infection,
Got it.
and using them for the shortest effective duration.
So it's not just about throwing antibiotics at every infection,
Exactly.
but being more strategic and thoughtful about their use.
Mm-hmm.
Why is that so important, especially in the context of neutropenic fever?
Well, as we've touched on before,
Yeah.
antibiotic resistance is a growing concern worldwide.
Right.
Overusing or misusing antibiotics actually fuels the development of resistant bacteria,
Wow.
making these life-saving drugs less effective over time.
Right.
And for patients with neutropenic fever who are already incredibly vulnerable to infections,
Yeah.
having antibiotics as a reliable treatment option is absolutely critical.
It's like preserving a precious resource,
Exactly.
making sure it's there when we need it most.
That's a great analogy.
Yeah.
And it's not just about using antibiotics wisely.
Right.
It's also about exploring alternative approaches to managing infections.
Okay.
The research you shared highlights some really promising advancements in diagnostic tools.
Okay. Like what?
For example, scientists are working on developing rapid tests that can quickly identify this specific pathogen
Okay.
causing an infection,
Got it.
allowing for more targeted and effective treatment.
That makes perfect sense. The faster you know what you're dealing with,
Right.
the better equipped you are to fight it.
Exactly.
Are there any other promising trends in research or treatment that stood out to you?
One area that's particularly fascinating is the research into how the microbiome, the community of bacteria that live in our gut,
Right.
influences the development and severity of neutropenic fever.
Okay.
There's growing evidence that a healthy, diverse microbiome actually plays a protective role, helping to prevent harmful bacteria from taking hold.
So it's not just about fighting bad bacteria,
Right.
but also nurturing the good bacteria that live in our bodies.
Exactly. And this research has opened up exciting new possibilities
Mhm.
for prevention and treatment.
Like what?
For example, some studies are exploring the use of probiotics,
Okay.
supplements containing beneficial bacteria,
Mm.
to help restore a healthy microbiome in patients undergoing chemotherapy.
That's really interesting. It seems like there's a whole world of potential within us
There is.
that we're just beginning to understand.
Absolutely. And that's what makes this field so exciting.
Right.
There's so much we're still learning about the complex interplay
Yeah.
of the immune system, the microbiome, and how they're affected by cancer treatments.
Well, this deep dive has certainly given me,
Yeah.
and hopefully our listener,
Uh,
a much deeper appreciation for the intricacies of neutropenic fever.
for sure.
It's a serious condition.
It-
But it's also clear that there's hope and ongoing progress
Absolutely.
in how we manage and prevent it.
Definitely.
I couldn't agree more. And I think one of the biggest takeaways from our discussion today is the importance of proactive communication with your healthcare team.
Yes.
Don't hesitate to ask questions, voice concerns, and advocate for yourself or your loved one
Absolutely.
throughout the treatment journey.
That's so important.
That's such an important point. Knowledge is power,
It is.
and feeling empowered to participate in your own care can make a real difference.
Absolutely.
And speaking of empowering questions,
Yeah.
I have one final thought-provoking question
Okay.
for our listener to ponder as they continue their exploration of this topic. We've talked a lot about how neutropenic fever differs from typical sepsis
Right.
in terms of the immune system's response,
Yeah.
given those unique challenges.
Yeah.
What innovative treatment approaches might be needed specifically for this patient population?
That's a great question.
It's a question that researchers are actively grappling with,
Uh-huh.
and it highlights the importance of ongoing research and individualized care.
For sure.
Thank you for joining us on this deep dive into neutropenic fever.
Of course.
We hope you found it informative and, most importantly, empowering.
Absolutely.
Remember, you're not alone in this journey.